Hi everyone, I'm Chris Leong again. Hello. So today the subject will teach you guys how to do the DIY of the knee injury. And a lot of people thought their knee they are twisted and cannot squat down, cannot bend down. It's due to so many problem. So especially a lot of people, hey Chris, I want to ask you, my knee, I don't know, it is not enough calcium, and then that's why not enough the gel on my knee, what I call the cartilage touching. That's why my knee is very painful. I think I'm old already. I think now I'm 55 years old. That's why my knee pain, and walk cannot, squat down cannot. Even I go up the staircase cannot, down the staircase also cannot. Usually for the knee problem, there are a few will affect the knee, especially you got a lower back problem. You gotta affect the knee also. And when you are in a washing or what, you are sudden split. We call it, this is called a sudden split. And let's say, I'm not fall down, but it is called like sudden split and jerk. And this part affect the knee until, oh, wow, cannot bend down like this. Wow, a bit painful. Or due to the futsal or badminton, a lot of a sudden stop, left, right, and like this, or like this. The sudden stop also, the knee will slightly misaligned. And the jumping from a basketball, when you jump the time and someone bang you and landed not in the right position, also will affect the knee problem. And the knee problem, that's why a lot of people or my patient, they'll say, not enough gel. So I do injection, 1 injection, 2 injection, 3 injection, but it's still pain. It's due to why the pain, because of the mechanism is not in the right position. So a lot of people like a sport, they're sudden stop a lot. Badminton, squash, basketball, and football, futsal. And when you're on the right floor, then sudden, luckily I didn't fall down. Better you fall down. If you fall down, then not that serious. If you not fall down, then this part we call it slightly twisted. And the jamming part. That's why you can see a lot of my video, and then you see the X-ray. And a lot of doctors say operation. So operation is one of the good solution also. If you go to the US or Australia or Western country, if you got any like a knee pain, see the X-ray. The best solution is called, we call it knee replacement. What is the meaning of a knee replacement? Put a 2 metal, 1 metal on top, 1 metal on bottom, and good. So actually for implant is good, or the replacement is good, because why? In the Western doctor, 2 type is very successful. The implant, the T, very successful rate. And the second thing, knee. If it cannot squat down or painful, is good. If some people got a knee problem, terrible pain or what, then I recommend you can do operation. But before you go operation, maybe you can look for the alternative way, like Theta or anything, the manipulation or chiropractor or anything. But chiropractor is, I think, in the spine only. But you can look for anything to call manipulation, the alternative method before operation. So usually a knee, very easy to check. And for me, I got a few techniques and a few tips for you to DIY. Then after that, you can feel much more better. All right, especially a lot of people got knee problem is due to cannot squat. And up the staircase down and down the staircase down. Up the staircase down, they are on top. Down the staircase down is bottom. They have two types. And then sideways. All right. So actually the knee mechanism is very simple. Just imagine this is a knee. You can bend straight and bend. You cannot rotate left and right. The only mechanism is called the front hinge. Like this, locking. This is a knee. And behind the ACL and PCL, or the tendon ligament or ACL torn or what, doesn't matter. So a lot of patients say, because of due to the football and injured, and I torn my ACL and PCL. So Chris, can you help? It's really torn, the actual. But what we do is called the manipulation back to the position. Then you can squat down, that's all. Then after that, they will take time to slowly repairing. All right, so you can see this is a knee on top and bottom, the knee patella here. So our mechanism can up, down, rotate left and rotate right like this. So a lot of people got injury and the injection, everything, but you're not in the right position. The knee is not in the right position. You jump how many times, it's like this one, still the same. Because why? Cannot bend, cannot straight, cannot rotate. It's due to the imbalance knot. So whatever you put the injection here and here, still the same. What we do is called align back to the, push back to the position. Whatever position correct already, then you can see the gap open up and close. That's all. So very easy. A lot of due to the sport injury or sudden twisted or what. All right, how to check? All right, let's say the bed over here. You try to squat down from here. Can squat. A lot of people squat until 90 degrees. Let's say got a knee injury person, they can squat until here. Cannot squat. Painful. Cannot. Very pain. Up. Cannot. Or even up the staircase. Up. Okay. When down the time. Painful. It's due to the bone attached to the bone. Okay. And before that, you can try at home also can. Using a small chair, put here first. Then you try holding something and see whether can go 90 degrees or not. Until here. Cannot. Oh, painful. Cannot. One more time. Down. Cannot. Very painful, my knee. Oh, painful. So, all right, doesn't matter. So, at least you got to check anything you can. Sit, you are lying on the chair only. Sit on the chair. All right. Today, I will teach you some DIY, and then I got a few patients did by himself, and it's work. And the most important, you have to understand the mechanism of the knee. So a lot of people, if you got extra anything, you can see the kneecap slightly one side. That's why you cannot bend, cannot straight. Sometimes you press very painful. So what you do, because you have to align back to the posture to one knot only. So they call this knot and rotate top. That's why you can see my video, I can do left top, little bit only. Can feel better. Then the technique is very easy. All right, let me show you. First thing, let's say I got this leg knee injury. What you do, let me show you. Knee injury, you cannot bend. Oh, painful. One of the best technique is using your arm. Put at the back like this, and try to snap and pull your hand slightly up. Touch a little bit and up. Here, sound, take one sound. So just imagine why I want to do this part. This is open up the two knee. Open up the two knee, and this hand correct over this part over here, and try to hear the sound top. Here the sound. After that, you can try and see again. Oh, quite loosen up a bit. Let's say you're very fat, obesity, or you cannot put your hand underneath. Is very painful. Wow, very painful. I cannot put. I cannot use strength. Doesn't matter. At home you can you get a water bottle also can help. So water bottle, how to do? Same thing. Put it like this on the bed. Put over here and press hard press harder, and you have to fill with water first, easier. Then after that, you try to sit on it, and sit and push in. So this one, push up. Wow, here's some top again. Why I got so many sound on my knee? Oh my god. Oh my god, my knee really got lost sound. You hear the sound? So whenever this technique done already, you can feel. You can feel the knee. When I do the timer, you put a water bottle or hand. Let's say you didn't have water bottle, you put hand underneath water bottle. When you push in the time, the knee bend the time and down and push in. Then you can feel this part and this part. Hear the sound. Top. Exactly. Whenever you're not in the right position, when you put the Tupperware, you knock back and try to open up. And open up a little bit and down. Exactly same like knuckle. Mr. Lyman, you press back and pop, and the sound same sound. Pop. Exactly same sound. This bottle is empty. No. Inside the water. So inside the water, if you possible, you try to put a full, because why? If you no water, the air inside, then you will decrease the pressure. So the technique is push your leg underneath like this. If you're not using your hand, then the bottle will go down, downward. When down the time, you snap the time, you push this water bottle to up. This is one of the best technique, and I did it during my ski time. You know, ski very long, and sometimes you fall down, you twist your knee, and your knee is slightly uncomfortable. So what I do, I'm using the arm, put underneath and snap it also can. The second technique, for the knee, let's say you're not there, you're very painful, or you're over 55 years old, and you got osteoporosis, and you're worried about too hard for you. So another technique is called 45 angle and push. So you can see my technique, a lot of my technique, like holding here and snap, pop. Then after that, you can see the patient the knee can bend. No pain, no. Before that, pain. Straight touching, pain. After snap on the left, right. So what mechanism is called push in back to the position. That's all. If you want to DIY yourself, you can do it out. Hi, Jacqueline, ciao. Like this. Like this. So this is an injury knee. Put in front. And if possible, this is a 45, let's say 45 angle to the side. And this hand, try to push over here and slowly and push. One more time, not too hard first. Using some like pressing the pillow. So imagine like this. Oh my God. Like pressing the pillow. The strap like this. Good. So how much to stand? Don't too hard first. Like this one, just imagine holding the pillow here and press. Correct. So you imagine when you press the time, don't too hard. If your palm can push the time, you can touch over your another palm, then not correct. Push the pillow only, push little bit. That's all. I don't want you using any force. Alright? Follow me one more time. Very easy. Stand straight. So, one step forward and tilt 45. 45, straight 45, outside, outward. And lean to front little bit. And here, pressing. And other one. See, you can feel the lock. Then snap slightly. Very gentle. hear the sound. Croak. Wow, my leg got so many sounds. So this one done already. Another technique is from this side inward, and then this leg cannot stand front like this. If it stands front like this, upper press, you fall down. If possible, open the side way. This one inward, you call open side way and rotate inward 45 to that angle. So your body facing to that angle, and this one, and try to in. Wow, hear the sound? Yes. So at least you try this part 1, and this one 45 and turn. So you got a mechanism one, we call it open on the left and right, and push and automatic back. So these 2 exercises will be, after you do already, then you check back again. How you check? Very easy. Same thing, just in case. Put the chair on top. This is put a one chair we call 90 degree. And this is because I'm standing high, easy for you to see. And like this, ask the patient holding chair or anything support, and try to bend. After a few times already, bend. See? I can sit already. One more time. My knee. Oh, feel better. Now I can sit on the chair, means a 90 degree. Let's say you feel comfortable, possible, without the chair, a small chair, and holding in front, and slowly down. Yes. Up again. Second time, holding something. If not, you fall down. Holding and try. If you over 90 degree, then should be okay. Means your mechanism part of your knee 2 side is correct position. So you can try this at home, quite effective, and you can see the amazing result. Especially for people got a knee problem before go for operation. They are up the staircase painful, down the staircase also painful, and also cannot squat down, and always knee walk too much, inflammation, and less walk, he subside. And after this one done already, have to do a little bit exercise. Exercise called Zhanzhuang. Same thing, this is a Tai Chi, the first step. Open up, side wide, same with your shoulder, wide and down. And standing like this. And standing just like this. Yeah, correct. Standing, same position, and holding for 2 minutes to strengthen back your tendon, ligament, and your muscle to gel back together. And if possible, try to reduce diet for sour thing, and take a lot of milk and cheese to more protein and calcium to strengthen back the knee. And this is a DIY for the knee. It's quite effective, and you can try. Especially, you can see the X-ray, the X-ray you can see slightly, then you can do. So this one of the best technique before you guys go to operation. At least you can try on the alternative method. At least you can see the improvement. Then you do another few more times, should be okay. All right, thank you very much. Wow, sweating also. Do a little bit also sweating. All right, see you guys. I hope you guys enjoy. And I'm Chris Leong. Thank you.